Good morning and welcome to the City of Toronto COVID-19 media briefing on January 20th. Today you'll hear from Chief Pegg, Dr. Davila, and Mayor Tory. Go ahead, Mayor Tory.
Well, thank you, Lavin, and good morning. I'll start off my remarks with some comments on the snow situation and move then to talking about COVID-related matters. Today, we opened up 311 to snow requests so that we can hear directly from residents about areas that need more snow plowing and clearing. Work continues to clear up the approximately 55 centimeters of snow that fell from Monday's major historic winter storm. Snow removal operations that is, where we truck away the snow to get it right off the streets, started last night, and this is expected to take several days. As we've explained, snow removal is rarely needed in an average Toronto winter, but this was a very big storm, and so it requires this particularly massive cleanup effort. Snow removal was started last night on the Gardiner Expressway and on the Don Valley Parkway and is underway now on St. Clair Avenue in parts of North York and downtown along Adelaide Street. Crews hope to tackle Bloor Street tonight for snow removal. This does have some noise associated with it when it happens at night, but I hope that people will show their understanding of this work that obviously they would like us to get done as soon as we can. All of this work, along with continuing to respond to any further weather, is ongoing 24 hours a day until the job is done. There is no resting from this. The work is continuing 24 hours every single day. I am meeting daily with city staff to get a report on this work. At the meeting that we had this morning, we heard that they're working to make sure that any local roads that have been missed or where equipment wasn't able to get in due to parked cars, and this has been a fairly frequent problem where the equipment simply couldn't get down the road to do the plowing and clearing because of vehicles that were on the road, that those are discussed at these meetings and they are being responded to. And so for those out there who are in that, I know, frustrating category of people who haven't had the basic plowing and clearing work done, please understand that we're on these particular situations and they are being responding to. The staff were very clear this morning. We were clear with each other that the cleanup is continuing wherever it needs to be done, across the city, of course, but where there are places where some extra attention is required, that is how we're devoting those resources. Our work, of course, also continues with respect to battling COVID-19 and the particular challenge of vaccinations, the single biggest challenge that the city has in front of us. Over the last several weeks, as we've been confronted by the Omicron variant, we have been working nonstop to do the most important thing that we can do, which is to make sure that Torontonians get vaccinated because of the protection that provides, and in particular a focus on third doses for all eligible residents. That is because our public health officials have made it very clear to us on a repeated basis how important it is for residents in those age brackets from 50 up to get vaccinated and to get the third dose. I'm proud to announce today that Team Toronto is continuing its vaccination outreach to more than 330,000 residents over the age of 50 who are now eligible for their third dose and in neighborhoods with low vaccine uptake. So we have two categories of people, those who had to let time pass before they were eligible for their third dose and those who may have been eligible for some time but live in lower vaccine uptake neighborhoods. And we're focused on those groups now who total 330,000 people. To date, approximately 65% of people age 50 and up have received their third dose since eligibility opened to this age group on December 13th, 2021. So that was just over 4 weeks ago, and that is a considerable accomplishment, but there remains work to be done. Of the more than 1.1 million residents in this age group, 609,287 residents 50 years and older have received their third dose already, but this leaves, of course, the 330,609 who have received their first and second dose, and this is very good news, but are now eligible to get their third dose. Given the continued spread of the more transmissible Omicron variant, there have been increased efforts by Team Toronto to reach out to residents who are 50 years and older and who have yet to receive their third dose, and especially in neighborhoods where there's low vaccine uptake. We know the third dose does make a difference. As Dr. Davila explained on Tuesday, for cases reported between December 24th and January the 6th, in the province, the rate of hospitalization for COVID-19 was 4 times higher for unvaccinated individuals than for those with 2 doses. An ICU admission was 8 times higher for unvaccinated individuals than for those with 3 doses of vaccine. We're powering up the VaxTO campaign to help us with the outreach to these residents who are in need of their third dose. Walk-ins, this is a very significant step that we're taking as well. Walk-ins will be available for residents 50 years of age and older at the 5 city-run clinics this Sunday and Monday, January 23rd and 24th, so as to encourage people to get their first and their second doses and their third dose if they're eligible. The VaxTO campaign will be reaching out directly to eligible residents 50 years of age and older who have yet to receive their third dose. This will be done via text messages. It'll be done to promote the walk-in appointments this Sunday and Monday at all of the city-run clinics. More than 53,000 texts are scheduled to be sent out today to people in that 50-plus age group about the availability of walk-in appointments at the city-run clinics this Sunday and Monday. For those who are not available to attend the walk-in appointments on Sunday and Monday, information will also be shared on how to book their third dose appointment through the provincial booking system, which you can reach by going to toronto.ca, and there's buttons there to take you to the right place. There are almost 23,000 appointments available at city-run clinics from today through to February the 19th. And so Team Toronto is also encouraging all eligible residents who have booked a later appointment for their third dose to move their appointment up to an earlier time at their convenience, because again, the earlier that you get the third dose, the earlier you have the protection that comes from that third dose. We're urging people not to wait for the third dose if they don't have to, because COVID won't be waiting in terms of the risk that it could pose to your health and to the health of your loved ones. So again, the same message that we've repeated over and over again, which is please get vaccinated. Please make sure people close to you get vaccinated so that you can protect each other and protect your own health and help us to move forward to better days and to a reopening. It actually is quite easy to reschedule your appointment online or through the provincial booking phone line, so that if you have an appointment that's quite a distance out and you were disappointed when you booked that third dose appointment at how late it was, it's probably timely to be moving it up now, which you can do. Residents should also cancel their appointment if they've also received their third dose, because this allows us to make sure those spots are available for people who need them. Hundreds of people have already signed up for Team Toronto's latest mass vaccination event, which is called Vax the Northwest, and which will be held this Sunday at York University's Aviva Centre from 11 in the morning until 7 at night. This is a great mega clinic event and a true team effort in partnership with the City of Toronto, Toronto Public Health, Humber River Hospital, University Health Network, Black Creek Community Health Centre, Unison Community Health Centre, Tennis Canada, and York University. I want to thank the media for helping us share information about this clinic with the residents in Northwest Toronto. The media has been an important partner in our Team Toronto effort, and we would appreciate any attention they can give to this event as we try to make sure every spot is filled, and we're doing very well in that regard. The clinic is focused on providing first, second, and third doses to residents who live close to York University and residents in close nearby neighborhoods which have under-vaccinated rates in those areas. We are also engaged in promotion and outreach efforts in those neighborhoods and to those neighborhoods for first, second, and third doses, which include connecting with residents in the neighborhoods, the target neighborhoods by Team Toronto's partners, promoting the clinics to residents in nearby Toronto community housing buildings, and sending thousands of text messages and broadcast voice messages to Northwest Toronto residents through the VaxTO campaign. So there will be about 8,000 texts that will be sent to residents 50 years of age and over, for example, who are due for their third dose, living in areas immediately adjacent to York University, so it's very handy for them to attend and get their third dose at that time. And there will also be thousands of broadcast messages sent to 30,000 people in these areas, generally encouraging them to come or bring people who are not yet in receipt of first, second, or third doses. We also have a great partnership going with the TTC where 15 dedicated buses will be running from 11 different community hubs to the clinic at York University, which the community ambassadors and all these texts and phone calls will be promoting. So we'll have a means of transportation to help people get to the clinic at York University. And we encourage people who are looking to make an appointment to attend the Vax the Northwest to look in the provincial booking system with their postal code so that this clinic is an option for them. because this clinic is not accepting walk-ins in the same way it is by appointment, and we would encourage you to use your postal code and go to the provincial booking system where there still are appointments available. We really are making great progress on getting people vaccinated. The numbers, yes, they move more slowly now in these later stages of the vaccination campaign, but they continue to move because people continue to come out, and of course we have a very dedicated team of people who continue to organize these clinics. And I want to thank everyone who has been working on this campaign and everyone who's cooperated by coming out to get vaccinated, including those who've come out for a third dose. Residents who are stepping up to get vaccinated are doing something that is a major contribution to our efforts to get the pandemic behind us, to keep the healthcare system intact, to save lives and to save the health of people. And this is, together with wearing a mask and avoiding social scenes that are against the interests of public health at this stage, is something that we're grateful for and that we hope people will continue to do. The city, I'm convinced, will come back stronger than ever. There are all kinds of indications that I hear in that regard as I go about doing the rest of my job, whether it's to do with investment in the city or job creation or other exciting things that we can look forward to, including in the arts and culture and all the kinds of areas that have been restricted in what they can do for a long, long time now. So I'm encouraged by that, as I am by the progress we're making on the snow, and we just have to keep everybody doing our job, particularly those of us here at the city, which we will do. And on that note, I will ask Dr. Davila if she would offer her remarks for today.
Thank you, Mayor Tory, and good morning. Yesterday, the province's Chief Medical Officer of Health noted recent declines in COVID-19 cases and test positivity. I'm encouraged to see those trends occurring at the local level here in Toronto as well. Although provincial testing capacity remains limited and the true number of COVID-19 cases is higher than what we can report, we have seen a decrease in the 7-day moving average of COVID-19 cases in Toronto from 1,854 on January the 11th to 1,414 on January 19th. The percent positivity of COVID-19 tests has also decreased from 23.8% to 20.3% over the same period. Wastewater surveillance is an additional COVID-19 surveillance tool that involves the testing of sewage samples for the presence of the COVID-19 virus and helps us track potential trends in COVID-19 prevalence. This surveillance can be helpful as it provides some insight into the COVID-19 activity in the community, which is particularly valuable when testing is limited. Toronto Public Health has been collaborating with academic partners over the course of the pandemic to implement a pilot to understand and validate wastewater surveillance. These data have shown that wastewater signals have lined up with clinical data and show potential as a way to confirm trends noted in other data sources. When we consider COVID-19 surveillance wastewater data in Toronto from the Ministry of the Environment, Conservation and Parks from December 9th to January 8th, there may be evidence of a potential plateau or even a slight decline in virus activity detected in Toronto. All of these COVID-19 indicators I've just mentioned, our 7-day moving average, test positivity, and wastewater surveillance, are high, but there are decreases that provide reason for cautious optimism. While these are encouraging developments, it is still too early to confirm whether the Omicron wave has peaked. The experience of other jurisdictions suggests that this will occur sometime in January, and as additional data become available in the coming weeks, I expect we will have a clearer picture. For now, we must remain vigilant. Since Tuesday, hospitalizations, ICU admissions, and outbreaks have risen, and healthcare system capacity remains strained. We can expect this trend to continue into February, even after cases peak, and we need to continue to do all that we can to preserve our health system's capacity during this very challenging time. As the Omicron variant is so contagious, more and more of us are encountering COVID-19 firsthand, whether we've contracted it ourselves or have friends or family who've fallen ill. To all those who are battling COVID-19, I wish you a full and speedy recovery. While many of us will not be able to avoid Omicron, we can take all of the measures possible to keep from contracting the virus or spreading it. Continue to limit our in-person contacts, wear a high-quality and well-fitting mask, and of course, get vaccinated. We have strong evidence from Ontario that the COVID-19 vaccine remains highly effective at preventing severe outcomes from Omicron, including hospitalization and admission to the ICU. As the Mayor just reiterated, for cases reported between December 24th and January 6th in Ontario, the rate of hospitalization for COVID-19 was 4 times higher for unvaccinated individuals than for those with 3 doses of vaccine, and the rate of ICU admission was 8 times higher for those who were unvaccinated. As of January 17th, approximately 87% of Toronto residents aged 12 and up have received at least 2 doses of the COVID-19 vaccine, and nearly 42% have received a 3rd dose that provides an important boost in protection against Omicron. We also continue to make progress towards vaccinating 5 to 11-year-olds, with 51% of Toronto residents in this age group now having at least 1 dose of the vaccine. I am so encouraged to see Torontonians' continued commitment to vaccination. And Toronto continues to be a world leader amongst large municipalities in this regard. Toronto Public Health and our Team Toronto partners continue to expand opportunities for eligible Torontonians to get vaccinated with a 1st, 2nd, or 3rd dose, as you just heard from Mayor Tory. I know that we are all looking forward to the day when public health measures and restrictions are scaled back or no longer necessary. 2 years into the pandemic, I remain impressed by your continued resolve, resiliency, and adaptability in confronting the challenge the virus, in all its variants, has posed. These efforts are paying off and will continue to do so if we all continue to do our part. This pandemic will end. For now, I ask that you continue to do all that you can to protect the gains we have made together. I'll now turn it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. Davila, and good morning. Before I provide my update today, I'd like to extend my deepest condolences to the family, friends, and all those impacted by the tragic fatal fire last night on Gladstone Avenue. As always, our Toronto firefighters give their all to save lives, and at times place themselves in harm's way in the performance of their duties, especially during rescue. I would like to acknowledge and thank our extraordinary Toronto paramedics, along with the nurses and doctors in hospital who treated our injured firefighters. I'm relieved to report that each of our firefighters have been treated and released, and we are sincerely thankful for that. The investigation into the origin, cause, and circumstances of this terrible fire is now underway in collaboration with Toronto Police and the Ontario Office of the Fire Marshal. Yesterday, our emergency and essential services operated with an unplanned absence rate of 14.6%. Between December 24th and January 19th, our emergency and essential services operated with an average unplanned absence rate of 12.5%. Our team continues to implement their mitigation plans effectively, thereby ensuring that these essential services continue to be delivered across the city. From a citywide perspective yesterday, we operated with an average unplanned absence rate of 6.7% across all of the city divisions. Yesterday, Toronto Paramedic Services operated with 116 ambulances on the road and an unplanned absence rate of 16.7%. Chief Raftis continues to work with hospital partners to quickly release paramedics from hospitals so that they are available to respond to emergency calls as very quickly as possible. This work and these discussions are continuing. Also yesterday, Toronto Fire Services operated with 120 frontline trucks and crews in service and an unplanned absence rate of 11.3%. Fire services are continuing to respond to additional low-priority paramedic calls each day where there is no clear indication of a patient or injury. Each of our other emergency, essential, and critical services, including Toronto Police, Toronto Water, TTC, Shelter Support and Housing, Senior Services and Long-Term Care, Children's Services, and our city-operated COVID-19 vaccine clinics, also continue to provide exceptional service to Toronto residents, and I thank them also. Each of these teams continue to do an exceptional job of managing through the challenges associated with increased numbers of staff being unable to report for duty as a result of COVID-19. Our COVID-19 Strategic Command Team continues to work every day in order to ensure that all aspects of our citywide response to the pandemic remain responsive and effective. As the situation with COVID-19 continues to evolve, so will our planning and response. As always, I encourage you to continue to make toronto.ca/COVID-19 your first choice for up-to-date, accurate, and timely information on all aspects of COVID-19 response in Toronto. Thank you.
Thank you, Chief Pegg, Dr. Davila, and Mayor Tory. We will now open the floor to questions. As a reminder, it's one question, one follow-up. We will unmute you when we say your name. And just so you're aware, we do have staff on the line, including Barbara Gray, Paul Raftis, and Vincent Safraza, if you do have any technical questions. First up, we have John Woodward from CTV. Go ahead, John.
Hi there. We did a story yesterday looking at some of the blockages in sidewalks, residential areas, as well as large commercial landlords. And I wondered, first of all, how many sidewalk fines have been issued by the city? You think it's $135 a pop to try and get people to clear them? And what advice you would give to people who have blocked sidewalks still after this long after the snowfall?
Sorry, I didn't hear just the first part of the question, and I'll start and perhaps ask Vince to follow up. What was just the first part about sidewalks?
Just that we profiled a number of places yesterday with blocked sidewalks from the snow, whether they were windrows from the snow plows or just private landlords failing to do their duty and clear.
Well, we're actively engaged in that. Part of what I think people will understand is that when you plow the snow off the road, sometimes it ends up as a first step in places where it would be best not be, which might be on a sidewalk or somewhere else. And now part of the continued snow clearing operations extends to making sure the sidewalks get done as well in the vast majority of places of the city. And that's going to be a new service for some parts of the city that haven't yet received it. People, will, I hope, will also understand as they call 311 with service requests for the snow, these will be dealt with in an order of priority based on what the service request is, and that the bottom line is that the operations are continuing 24 hours a day. When these calls come in, they're being responded to, as I think you yourself saw yesterday, and we're doing our very best to respond to places that have been either missed or that need a second or third visit in order to address things like snow on the sidewalks, in some cases the windrows, and so on. Vince, do you want to pick up from there?
Thank you, Mr. Mayor. So I just want to echo that, in fact, yes, we have not stopped our sidewalk operations. We are continuing. The nature of the event, its intensity, but also the idea that you have less storage capacity on the sidewalks, it does pose a few extra challenges for our operators. Having said that, though, they are committed to continuing with the sidewalk operations. And as of this morning, we are accepting 311 service requests for sidewalks. So we encourage the general public to give us a call and help us identify if there are any missed areas. That would certainly also allow us to focus our efforts. But it is ongoing as we speak today.
I'll just say in thanking people, you may have a follow-up question. In thanking people for their patience and asking for their continued patience as we do very methodically and with all resources deployed 24 hours a day go through this, that I certainly do understand that obviously as you try and move this massive quantity of snow around, there's not answers sometimes that happen instantaneously, but we're working at this 24 hours a day. Every piece of equipment, every crew is deployed, and we are now to the stage, having done a lot of the clearing across the city where particular targeted areas can be responded to, and those are being reported to me and to the other senior officials as to where service requests are coming from, and we're following up on those, and I think doing it in a very diligent manner.
I guess my question was more about the private operators, because the city has an enforcement regime to get private landowners to clear sidewalks in front of their property. And so my question is really, what are you doing about the private landowners? And I guess a specific way of measuring that might be the number of fines issued under that $135 a violation regime. So how many fines have been issued?
I can't answer that question myself. I don't know if there's anybody on the line who can answer that question. We can certainly get back to you if we don't have it with somebody that's on the line. Vince, do you have any knowledge of that?
So we do have our patrollers out on the road that are looking specifically at this situation where you do have a plow out, which is not very beneficial practice, and as you said, legal practice. So we are looking into that, but I don't have the statistics here readily available. We can certainly provide that later.
John, we can provide you that. We'll reach out. So next up,
Okay.
we've got Scott Laurie from The Sun. Go ahead.
Thank you very much. We've heard from a number of people who are pretty frustrated at the snow removal, especially after they've done a lot of shoveling in front of their homes. We heard from a couple in their 80s who said that city plow came by and snowed in their driveway after they paid to have the snow removed. What should, a couple like that or people across the city like that, what should they do when the city plows do that? Especially when we heard they called 311 and got nowhere.
Well, I'll start, and again, Vince can pick up. First of all, the notion that when people say they call 311, there is no answer is just not, I mean, there could be an instance in 1,000 where that happens, but 311, each of the service requests is carefully recorded. They're categorized. I've seen the summaries myself, so I know that they're being taken in that careful a manner, and they will be acted upon, although as I indicated, they'll be acted upon in a prioritized manner because the crews, as many as there are hundreds of them, can't be every place at once doing everything at once. I would also remind people in a very courteous but straightforward way that they're not supposed to shovel their own snow out onto the street, whether it's being done by themselves personally or whether it's being done by somebody they hire to do that, because then obviously we will get a phone call from somebody saying the street needs to be cleared again. The plow will come along and plow the street, which is our responsibility. But if the snow's put somewhere else and up onto the sides, it's going to make it a lot easier for us to keep the roads passable, make them safe, and make sure that that we don't have to come back and block up people's driveways. So on that note, maybe I'll ask Vince if he will follow up on the question as well.
Thank you, Mr. Mayor. So clearing the front of driveways is a targeted service that we undertook over the last few days. So we appreciate that there were instances where a road plow had placed the snow over to the side and may have blocked the front of the driveway. We do have a follow-up service where another piece of machine will clear that snow in front of the driveway. Again, due to the sheer magnitude of the amount of snow that has fallen on the city the last few days, it's been a bit more of a challenge than we had normally experienced. But having said that, I have enhanced this service. So we do have vehicles right now, equipment that are specifically targeting clearing the snow in front of driveways. And 311, once again, is an opportunity to provide any specific locations that could be brought to our attention. But having said that, we are actively pursuing this service.
And we're just going to check if Barbara Gray has anything else to add to that.
Thanks. I was actually just going to go back to the question about the bylaw officers and clearing out the front of and issuing tickets for people who don't clear their sidewalks. As you know, we do send our officers out every year. It's usually after our initial cleanup is done, and as Vince mentioned, due to the volume of the snow, we are still working through our sidewalk plowing, ongoing, and will be at least through today. But that is an activity that does happen. Our bylaw officers do go out. We do issue tickets every storm to people who haven't necessarily gotten there, and we will continue to monitor that situation.
Thank you, Barbara. Okay, Scott, do you want to go back to your follow-up question?
Yeah, on a different topic, there's been some reporting about 911 call delays. What kind of delays have you noticed? What's the average wait time for people calling 911? And just on ambulance calls, how many calls has the fire service been answering that are high priority, that become high priority?
Well, I'll start off, and maybe Chief Pegg will want to pick up, and others who are on the line today. 911 receives about 2,700 calls every single day. The average wait time for those calls spread across the time when they're taken is between 8 and 33 seconds, and I think they do a very good job. There are obviously fluctuations that happen from time to time when a major event will occur. Many people are doing what is the right thing for them to do as citizens and calling 911 to report it, but of course many others are often doing the same thing. We have highly trained people there that triage these calls and deal with them as best they can. You know, it's something that we are looking at all the time in terms of making sure that we can maintain a high level of service, because by definition people are supposed to use 911 when there's an emergency and make sure we can respond quickly to those who are in need. But it is a dynamic environment, and it will fluctuate depending on circumstances. Every time these numbers are reviewed on a very, very regular basis, and trying to make sure that that kind of a standard of quick answer and quick response is adhered to. Perhaps I'll turn it over to Chief Pegg on the specific questions.
Sure. Thanks, Scott. Good morning. Thanks for that question. So I'll answer it in two pieces. With respect to fire service response to the low acuity, so that's low priority, low risk patients and calls, that's about 60 calls a day, give or take, average numbers, of course. With respect to high risk, high priority, high acuity, life-threatening, whatever vernacular you prefer, fire services has always been part of that response under the tiered response agreement. And that, of course, is something that happens every single day across the city in conjunction with, of course, Toronto Paramedic Services, fire, and police. So that's nothing new. That's a very substantial number of calls that happen across the city. Again, those life-threatening calls. I don't have the data in front of me, Scott. I'd be happy to take that offline, and we can get back to you with those stats and data.
And then checking if Chief Raftis has anything to add to that.
Yes, thanks very much. Just along with what Chief Pegg had mentioned, the City of Toronto really enjoys the best-in-class contingency plans with emergency services. For more than 25 years, we've shared a tiered response agreement where we have Toronto Fire Service, Toronto Police Service, and Paramedic Service responding together to life-threatening calls, both from a first responder perspective and then subsequently with advanced life support coming in to support that. So there would be tens of thousands of those calls that are responded to every year as a tri-service. And again, that's been going on for at least 25 years now, and that has not changed during the pandemic or currently during Omicron.
I think the major point, perhaps to conclude this part of the discussion on, is the following. The 911 call center and call service is safe. And it is operating in a safe manner, and it is responsive to the emergencies that are upon us. And so I think that's really what people need to hear, and I think that is the case.
Follow-up? Oh, okay, sorry. Next up, we have Momin Qureshi from 680. Go ahead, Momin.
Good morning. Thank you so much for taking my question. Mayor Tory, the Premier is set to speak later on today about the potential of reopening businesses, restaurants, and the like. I just wanted to get your perspective on whether you support that move and what you would like it to look like in terms of capacity restrictions, that type of thing. What are you hoping to see, or what do you think should happen here?
Well, first and foremost, this is a provincial decision. And I think all of us, whether it's a mayor or a doctor or anybody involved in any of this in any way, which means all of us, would like to see us reopen as soon as we can, as many things as we can, but to do it safely. And that means to do it on a gradual, responsible kind of basis, and we will hear the details of what the Premier has in mind. But I think whether you look at it from a sort of mental health, from a business, or even from a public health perspective, we would all like to see us able to get back to normal as soon as we can, but to do that safely, which has been suggested, means it's done on kind of a gradual basis, and the news report suggests that's some of what might be coming, but we'll have to wait and see what he has to say, because it is a provincial decision.
And just for my follow-up, I'd like to hear from yourself and Dr. Davila as well as to whether you think the timing is right for this. Kids have just gone back to class just yesterday. We don't know what that will look like in terms of the spread of cases and the data. Do we have enough data yet to support this idea of going towards the reopening here?
So why don't I start, and we'll see whether the mayor has anything further to add to that. I would echo the mayor's comments that in fact this is a provincial decision, and I trust that they are taking into consideration all the data that are available to them, which of course are a little bit different from what we see here at a local level. We of course are focused very much on what's happening here at the local level, and I think the mayor it was quite right in saying that we are all eager to see the resumption of activities, including in-person learning and all the other activities that enhance quality of life throughout the province, and especially here in the city of Toronto. So to my mind, what does that look like? It does look like a gradual and cautious approach. We are, of course, monitoring our data. These are the kinds of things that we're able to do at the local level, and that's where we're focusing our efforts. How do we restore activities as much as possible, in-person learning and all the other activities that add to our quality of life, particularly here in the city? How do we do that in a way that is in keeping with our data? And how do we at the local level continue to work with our vaccination partners to do everything we can to support safe conditions for reopening and resumption of all the activities that we've missed for so long? Key amongst that is going to be our vaccination efforts. You've heard quite a bit about what we're doing in that regard to continue to get people in the city opportunities to have the protective benefit of vaccine. So that's what we're focusing on at this point in time, and of course we're interested in hearing what the provincial announcement looks like, and we'll manage the rest of the situation and continue to address the situation on the ground based on the data we have, and with keeping vaccination front and center as a key part of our toolkit.
Could I just really underline one point in that regard? There's lots of interesting debates that have taken place over 2 years now, and they're very substantive because they do affect the livelihood of people and a lot of other things to do with their general state of well-being. But one of the reasons why Toronto, I think, has been, reasonably successful, relatively speaking, in dealing with this is because we've kept a discipline, a single-minded focus on what we can do to make things happen in a positive way as best we can. And right now, that is why you hear us talk so much about vaccination and about the efforts we're making with the 50+, about the efforts we're making with the kids between 5 and 11, about the third doses, about the areas that are under-vaccinated, because there are some serious discrepancies between one area of the city and another. And so we're just going to stick to that disciplined approach, and we're going to, whatever may be going on around us, we just are going to stick to what we know we have to do, which is get people vaccinated, persuade them to be vaccinated, make it accessible to them, and just get it done.
Thank you. Next up, we have Mark McAllister from City News. Go ahead.
Thank you. On that note, when it comes to trying to get more people vaccinated, your announcements this morning that texts will be sent out to people trying to get more people to walk into certain clinics. Is this evidence perhaps that people aren't taking up the opportunity to get their appointments scheduled, that you need to make this extra effort?
Well, I will start. This doesn't come as any surprise. It's human nature. anytime you have a campaign of any kind, the first part goes a little more easy because you have the people who are eager and the people who, it's kind of the build it and they will come. But you know that as you get to the latter stages of any campaign, to get people to do anything, that it gets harder, and there are sometimes reasons that are just human nature, and there are other times reasons that have to do with accessibility or with to do with hesitancy. And so that's why we're using every tool in our toolbox, including not just communications tools like text, but also the community ambassadors who quite literally go to the doors of people and are in a position where they can explain and reassure people with respect to the vaccinations. And even I sat when we passed over the 80% threshold for 2 doses a few weeks ago and thought to myself, well, it's taken us a while to get to 80%, say the last 5% getting to 80, and, will we get to 90? And, lo and behold, we're slowly but surely making our way there. And I said weeks and weeks ago in this very forum that we knew it was almost going to come down to one vaccination at a time, one door at a time, one building at a time, one street at a time. And so you learn to be not satisfied, but patient, in the sense that we just have to keep at it and keep deploying the resources and keep coming up with new things like Vax the Northwest, having the buses to take people, having the text messages to remind them, and we will get there. Because, we've come a long way. If you think back to the fact that our first mass vaccination clinic opened a year ago this week, the first, and we've now delivered, I think, more than 6 million doses through those and other clinics. And so we will get the rest of the way there. We just have to be patient and determined. And I can assure you we have both patience and determination.
Perhaps if I can just add one little piece here. I think the mayor has hit the nail right on the head. I think that what we're seeing is evidence that we're progressing through the natural phases of a vaccination campaign. And the first part of the campaign allows for the greater reliance on large-scale, high-volume clinics. And over time, as you progress through the campaign, you have to use different methods, exactly as the mayor spoke. Those that are more focused, using hyper-local methods, as we call it here in the city, getting to those areas where we know there are more challenges with respect to access and uptake. And that's exactly what we've done before. It's what we're continuing to do. Because we've seen it work. And so we look at the situation on the ground and adjust our actions in accordance with what we see, evaluate, and then adjust again. So it's the next phase in the campaign, and we look forward to being able to work with our partners to continue to see that progress in vaccination coverage over time.
Thank you. We've certainly seen the city bounce back within the course of a couple of days, almost getting back to the point of normal. Do you think that the last couple of days and the fact that we're still digging out a little bit hampers those vaccination efforts at all?
Well, perhaps I'll start first and say that clearly, the significant snowfall impeded the ability of people to move around the city and affected all kinds of activities in the city, including the delivery and the administration of vaccines. But certainly we've been pleased to continue to see the interest of people in participating and rolling up their sleeves. We've seen many, many Torontonians do this. We're continuing to see many Torontonians more coming forward, rolling up their sleeves, getting that protective benefit of vaccination. And I think that that's what has led us to be truly world leaders when it comes to vaccination coverage. When you look at large major metropolitan centers such as ours, we are right there at the top, and this is thanks to the efforts of Torontonians and, of course, all those who participate as part of the Team Toronto partnership. Mr. Mayor?
I'll just say, of course, when we were forced to close our clinics during the storm on Monday, both because the clients were less likely to come out during the storm, and I understood that, and also the staff had some difficulties getting to the clinics, that's going to cause you, with respect to those numbers of appointments on that day, to have to reschedule those, and it slows you down a tiny bit. But the bigger issue for us is the difference that exists as between one part of the city and another with respect to vaccination rates. And there are areas of the city where quite literally there are 85% of people who have received a third dose, or 85% of the kids who've been vaccinated, and other areas in the same city where that same number is 25%. And so that is why you see us having these very hyper-local, as Dr. Davila said, hyper-local efforts to address the areas of under-vaccination. Nothing has stood in our way. I mean, a storm gives you a day where you're a bit dislocated for the day, but nothing is standing in our way. Our determination on this is absolute because we know that in the areas where it's 25%, those people are more vulnerable, and they're more vulnerable in many respects, but they're also more vulnerable to getting sick and their families, and they're people who have to go out to work, and there's a whole bunch of reasons why, just starting with the fact they're fellow human beings who live here in Toronto who need that protection. And so we're just very determined to deal with that no matter what comes our way, and we're doing it. The numbers are continuing to move up. Yes, they move up more slowly than before, but they continue to move up, and we're just going to keep at it and get them to where they need to be.
Thank you. And last, we have Francine Copen from the Star. Go ahead.
Good morning. My question today is for Dr. Davila. Dr. Davila, there's a lot of people who had 2 vaccinations who also developed Omicron, or they ended up becoming infected with COVID-19, even though they had 2 vaccines because of the increased transmissibility of this new variant. What is your recommendation to them in terms of the 3rd booster shot? Do they still need to get it? And if so, when should they get it? Should they get it as soon as possible, or should they wait a few weeks after they've, finished fighting the COVID?
So Francine, that's a great question, and certainly one that we've encountered, particularly in light of the highly transmissible Omicron variant, exactly as you've said. So yes, there are people that have received vaccination, sometimes 2 doses, and have gone on in recent weeks to get an Omicron infection and are now in a position to think about what should they be doing about a booster. First and foremost, I would absolutely recommend for those who are eligible, and that includes these people, so over 18 years of age, even if you've had a COVID infection, it is still absolutely worth getting a booster. This is the advice that we've seen put forward by the National Advisory Committee on Immunization, and it is, good advice to follow at this point in time. Clearly, what we want is for people to fully recover from their illness. There is an isolation period that's associated with an Omicron infection, and we would ask that people respect that isolation period and ensure that they're actually recovering well from their symptoms before they go and seek that booster dose. You are, of course, in this province eligible to receive a booster dose when you're at least 84 days after your 2nd dose of vaccine, and you are not actively sick with COVID-19, and you've met your isolation period, and your symptoms are improving. We don't want people to, go when they're feeling unwell. As for when exactly it should be done, you'll be interested, I'm sure, to hear, Francine, that this is still a bit of a subject of debate. We're still dealing with a new virus in the grand scheme of things, and a new vaccine, and in particular here, we're dealing with a new variant. However, it is safe to get the booster after you've recovered from the illness and have, no longer are having symptoms. Locally, I've heard in the province, generally they're saying about a month after the illness is a good time to get the booster. But my understanding as well is that the National Advisory Committee on Immunization is actively looking at this question and will be issuing further guidance on this in the not too distant future, so I hear. So hopefully we'll have more specific information from science, but certainly we know that there are advantages to getting the booster even after infection. Now it's just a question of fine-tuning as more science becomes available.
That's great information. Thank you. Just as a follow-up, people reported side effects for the 1st and 2nd vaccines. Are there fewer side effects with the booster, or similar to the original 2, or how do they compare?
Francine, I don't have the specific data on that with me. Anecdotally, I've heard the entire spectrum of reports, from some who said they had absolutely none to others who said they had more than they did with earlier doses. So I'm certainly happy to discuss with you offline what the data we have looks like. But I would say this, that in general, looking at the reports in respect of any significant events, following immunization, this continues to be a very tiny proportion of vaccination events, or to occur in a very, very small proportion of vaccination events. The last report that I saw, which had data up until the 10th of January, if I remember correctly, it was a fraction of a percent, a small, less than 0.5% for sure, where we saw significant events following immunization. Speaking again to the safety of this vaccine, and we've actually witnessed ourselves the effectiveness of this vaccine, not just here in Toronto, but in jurisdictions all around the world.
Thank you, everybody. That was the last question. Have a great rest of your week.